So let's just take a few questions from on this topic. Thank you so much. Maybe this is a naive question, but how far away are we from where fish farming, agriculture has progressed to pharmaceutical production side of things? Are people doing this in situ at all?
Yeah, so that's a very interesting question, the idea of aquaculture of some of these species for their pharmaceutical products. And that is done. Depends on the species. Of course, in a very short presentation here, I couldn't cover all that I would want. But as one looks at these 9 drugs that have actually come from marine life and asks the question, where did they come from? Most of them came from, it turns out, sponges and tunicates and from a sea hare that goes around. But one looks more deeply into the question, it's really not coming from the sponge, the tunicate, or the sea hare. It's coming from symbiotic bacteria and cyanobacteria that are either living within the tissues or are being preyed upon in the case of the sea hare. So the real drug discovery gold mine in the sea is really in its rich microbiota. But that microbiota is intimately connected to these macroorganisms. So having said that, yes, there's a compound called selenosporamide A. My colleague Bill Fennicle at Scripps made this discovery some years back, and it's being developed by a company, although there's been some problems, I think, in phase 2 trials. But they were doing seawater culture of the producing bacterium for that source. Okay, what about cultivation of larger organisms? Various people have tried different things at different times. There's a discodermia sponge that was being grown in New Zealand and gave rise ultimately to this molecule I mentioned, rubulin, that's now produced by chemical synthesis. Others have tried some things along these lines. And then, of course, there's the algal biofuels dimension of things. Right. So there's a lot of technological developments going into mass culture of algae. That represents, I think that's going to have payoffs and spin-offs to other branches of ocean science.
Just on that point, one of my colleagues working on algae fuels, microalgae fuels, is finding that wastewater nutrients are enough. There's enough carbon nutrients in wastewater. So we really could be thinking of all our urban coastal cities, or anywhere really, turn them into energy productions.
There are so many pluses with algal culture in that you're not growing stems and wood and roots, you're growing all cells that actually produce the compounds that you want, usually triglyceride oils, although we're also looking at hydrocarbons, which would be drop-in fuel ready without any processing. Yeah. But yeah, you can use wastewaters, seawater, non-arable land can be used for their culture. A lot of pluses.
Tell me, have island nations recognized assets and have sought to protect them at all?
Yeah, so this is an issue, is the indigenous rights that countries have to their genetic resources, and was first addressed in 1993 with the Rio Convention, as I guess there's a yearly conference, and was most recently in Nagoya with the Nagoya Accord. So there are very definitely proper behaviors, and I think everybody's pretty much following that now, that you have to have permission to access these organisms from the national governmental body, and that there needs to be reporting and benefit sharing. I'm a member of and lead a program in Panama called the International Cooperative Biodiversity Group, funded by the Fogarty Institute. These are inspired programs that connect drug discovery from biodiverse rich but economically deprived countries, and couple that with a lot of benefits to the country. Most of the money our program goes to Panama to support 3 laboratories in Panama. So there's a lot of infrastructure development, training. There's a lot of benefits along that path of drug discovery.
Jack?
Yes. Oh, I didn't see you, Reverend Dick.
3 very quick ones. One is, have you done any work around the really hot undersea vents? 2 is, we see emergence of resistant organisms when low-dose antibiotics are used in large quantities in animal feeding operations. We see it not only in the animals themselves, but in the people and actually the environment around them. And then 3, with the advent of so much fish farming, particularly shrimp in the old mangrove area, or not old, but what were traditionally mangrove areas, I imagine that there are some real antibiotic resistances that are appearing there because they use a lot of antibiotics in aquaculture, as you know.
Right.
Your thoughts on that?
So yeah, on the deep sea vents, of course, that requires some specialized gear to get there. One program I'm aware of is up at Oregon State University. They've been off, and they've written, I think, a fairly critical review in something called Natural Products Reports on mining the deep sea for pharmaceuticals. So there is some work, but it's it's much more expensive the moment you start to think of going that direction. Let's see.
It's really about huge amounts of antibiotics going into aquaculture.
Right. So antibiotic resistance, and I think some in the audience know this better than I, but as you develop resistance to one class of antibiotic, oftentimes you become multiply resistant because it's an increase in an export pump that exports any kind of foreign chemical from the body of the bacterium. So that those mechanisms, I think we're really playing rather dangerously at this moment in time. We'll look back and say that was a bad idea to be using antibiotics as freely as we are in our livestock, be it livestock or in aquaculture. So I did. There are, I think, in shrimp culture also fungi are a big problem. And there are some efforts to do some co-culturing of shrimp with microalgae that produce natural antifungal compounds and have a system, as it were, that perhaps would not be subject to a development of resistance.
Back to ecosystems.
Yeah, that's right.
So you were talking about the hormones and growth antibiotics in agriculture and in large feedlots and whatnot. But what about the pharmaceuticals discharged in wastewater, or just drugs that are never used that are flushed down the drain? Have you seen any evidence that the low concentrations that I've seen reported have any effects on ecosystems in and around these urban areas?
I haven't seen those data. That's a bit out of my field. I don't think it sounds like a very good idea, but in terms of seeing published work on that, I haven't.
Please.
I think.
I didn't. Yes, I didn't see you over there. Please.
Sure. This is Julie Turton from NOAA again. Yeah. Very nice talk, Bill. And I wanted to take a step back when you were talking about the international conservation bioprospecting groups. You talked a lot about how biodiversity and some of the ocean acidification, climate change can affect genetic structure and potential changes of loss of drug discovery. Could you talk a little bit, too, about the flip side we don't hear quite so much about, in that there have been some discoveries in the process of looking for drugs from the sea that have led to improved conservation measures. So it's actually gone the other way and stimulated local economies, local fishermen to conserve and manage their resources differently because of the efforts to understand that.
Well, you made the point beautifully there. Our program in Panama actually is a bit of a poster child for that, and it happened as before I became involved, and then during my involvement as a principal investigator of that. So from about 2000 up through about 2006, we led a charge that there was an island off the Pacific coast of Panama, about 10 square miles, called Cueva, and it was a historical home of a prison where the prisoners were locked up at night, but let out by day to raise their food. But generally, because it was a prison island, it became taboo to go there, and there were armed guards and whatnot. So by and large, that kept it free of any development and encroachment by timbering enterprises and the likes. And so it's a very pristine island. While they were moving prisoners off the island, it became uneconomical to maintain that, and there was thoughts what to do with Cueva. At one point, they were going to put in mega hotels and golf courses and that type of thing. I've traveled a lot in these expeditions. I don't think I've ever been any place as remote and seen nature in its more pristine character than I have in Cueva. So it's a really special place. And anyway, so our group and others, various NGOs, pushed forward to have this named a national park within Panama, and that was in fact accomplished, and then also led the charge to have it named a World Heritage Site. And it was it's now a UNESCO World Heritage Site. They have a park plan. It's got resources to govern the park and police the park, which is necessary because there's incursions by fishing fleets and whatnot into that area. Please.
Keith Martin, Consortium of Universities in Global Health. Thank you very much for your talk, and congratulations on getting that area as a UNESCO World Heritage Site. My question is, given the devastation of coastal ecosystems in Southeast Asia and around Thailand and such, and to a lesser extent in West Africa, can you perhaps share with us what's being done to share your work with development agencies so they can start to implement solutions that will enable them to have better management of those coastal ecosystems, given the impact of what's currently taking place on security for the peoples who live in those areas?
Boy, that's your question tells it all. I think that's something that absolutely needs to be done. I'm just not, I've not been involved in those kinds of efforts, to tell you the truth. We have international conferences. We had one about 2 years ago in Thailand, which brought a lot of people together from that part of Southeast Asia. And there's an appreciation for what the sea can provide in terms of drug discovery and medicines for diseases that we don't have appropriate therapies for at the present time, but I'm not aware of any, what the government, what's been done to actually push this forward in terms of governmental activities, on the global level.
Thank you.
Thanks. This is Paul Sandle, a member of the Roundtable and from NOAA. Bill, great talk. Thanks very much. One thing you mentioned that I hope is real, and that is the pharmaceutical industry and the supporting research enterprise rediscovering nature and rediscovering the oceans as a potential source for pharmaceuticals. The statistics you provided over success rates were really encouraging. And I know we used to fund a little bit of this stuff, and when I was starting back as a very young scientist a very long time ago, the National Sea Grant Program was one of the few things that funded drugs from the sea. And so many places have lost interest because the pharmaceutical industry just didn't maintain its own laboratories, and to be able to take that stuff from the academic sector and move it into the full-scale trials and eventual marketing. So I'm just curious, because I know some major pharmaceutical companies essentially closed down their natural products groups when we had some symposium on this topic a few years back. So are they rediscovering nature and specifically ocean sources? But I'd really like to see this as something we could push on for the future. So.
Yeah, thanks for that question. That's a great point. There has been from the large pharma. Large pharma has changed in many ways as a result of economic pressures and the process of drug discovery and the cost of drug discovery. I think it's fair to say that most pharmaceutical companies are rather conservative in their approaches and are run by the numbers. They have shareholders and they have to be responsive to those. So my take on this, because your point is well taken, there's only maybe a couple of companies that have real natural products programs in-house. Eisai Inc. is one. Merck has it, though it's distributed amongst different departments within Merck. Is that they've outsourced their risk. They outsource it to the small companies like Nereus Pharmaceuticals in La Jolla and other small startup companies where most of them are going to go bust. But every once in a while, one of them is going to come along with a pretty promising, get it up to phase 1 or phase 2 clinical trial, and then the company will be bought for $200, $300 million, and that's a good investment in terms of risk-reward for the large pharma company. So that's my take, and I've heard people in the industry also echo that that's their understanding of really how things are working at the present time. So the resurgence of interest is that people are hungry for good molecules. Synthetic libraries are flat, boring kind of things, and they just they don't have very good pharmaceutical properties. The one thing you can say about them is that they're synthetic and so that you can access them pretty easily. But they're just not very interesting biologically. And so they haven't discovered new targets with them. They screened, well, this was a major paper in, I think it was in Science on bad bugs. It was a retrospective by SmithKline Glaxo where they, for I think about 15 years, screened for antibiotics. And they used a lot of very innovative genomic approaches integrated into a high throughput screening program, and they came up with 0. And it was lessons learned. And one of their lessons was you have to start with good molecules, and our synthetic libraries, our company libraries, which are pretty much the same as everybody else's company library, are just not good starting places.
So, Bill, in that Tribune article, that little quote I had earlier, you talked about the silver lining of this toxic invasive algae, or no, seaweed, I think it was. And so what was the silver lining that you saw?
Well, the story there, and I don't remember making that quote exactly like that. In fact, I never talked to the paper, but they picked it up someplace. Yeah. Is there Jennifer Smith, a phycologist at Scripps, and her students had come across a overgrowth of corals on the coast of Kona, on the big island of Hawaii, and collected some, realizing they were cyanobacteria. They were overgrowing the corals, and they appeared to be killing the corals out in front of where they were overgrowing it, as if they were emitting something that was killing corals in advance of their overgrowth. And so they, knowing that we were studying the chemistry of cyanobacteria, brought that back to us. And we indeed isolated several series of different kinds of very bioactive molecules. And we can't close that loop because it's hard to do the coral part of that story, unfortunately. But we did isolate a number of very bioactive compounds, and one of them shows phenomenal anti-inflammatory activity, and inflammation underlies so many different disease states. So I think we have actually a very good lead in as an anti-inflammatory. So that would be the silver lining.
That's great. Yeah. Great. Hey, thanks so much.
Do you have time for one
Yes,
more?
I'd love to have a question then.
It's Susan Roberts. I'm the director of the Ocean Studies Board at the Academies, and it really was a terrific talk, Bill. But I had a question about the targets, that people use when they're screening for the activities. And are people looking for things like multiple drug resistance, whether you're looking at cancer cells or multiple antibiotic resistance? Are those potential targets for screening?
Yeah. Is this still on? Yeah. Okay. There's been quite an evolution in the thinking that goes behind how should we be screening for most effectively these natural products. And in fact, we were connected with Novartis for a number of years and screened in high throughput mechanism-based screens. So these were just like isolated enzymes produced by biotechnology to screen for the silver bullet that would knock out that enzyme. And I think that has been a valid approach, and drugs have been developed by that. But I don't think natural products interface with that kind of screening very effectively. So what's been presented in the literature, and I'm a big fan of, as a most effective way to screen natural products, and maybe other classes of compounds, is by phenotypic screens that give some powerful insight. For instance, let me take the example of the anti-inflammation. We can, in a cell-based screen, we can stimulate that cell to activate its pathways of inflammation. And then we can look at the end products of that. So between pathway activation or activation of the cell and end product mediators of inflammation like nitric oxide or some of the cytokines, there are many steps that intervene. There's a rich suite of potential targets there. So if we want to find new anti-inflammatory agents, I don't want to presuppose that this is the better target or that one is the better target, but rather let's look at the whole cell and the whole pathway. And so we use those whole cell screening, and that also opens the door for potentially finding new targets that you never would have suspected and you would have never screened for. You're also getting, at the same time, you know that this compound is cell penetrant. It gets through the cell membrane, gets into the cell, and it shows that efficacy. So I and others in the field are advocating for that kind of phenotypic drug screening.
And so people use like a multiple drug resistant cell line?
Yes, that is an approach, yes, absolutely.
Okay, thanks.
Thanks again. Linda?